Oh, is it safe for the president to get back onto the campaign trail? Joining us live this morning to talk about the president's battle with COVID-19 is Dr. Rob Danoff of Jefferson Health. Good morning to you, Dr. Rob.
Good morning. How are you?
I'm doing well. It has been 10 days since the president's diagnosis, so we hear he's eager to get back out there to continue campaigning as we lead up to the election. Do you think it's safe for him to actually be back out in public?
You know, he has a great team of medical professionals looking after him. So, if they're saying it's safe, it's safe. But, this is someone who was hospitalized. So he must have had a significant infection. And, going out after 10 days is really close timing. And anyone who's had symptoms where they've been hospitalized or been fairly ill, it's usually 7 to 12 days. You have to really monitor that period to see if they're going to have a worsening of their condition. But, it sounds like the president's been doing well. It's going to be day 10 tomorrow. So, we're going to wait. And supposedly they're testing the president, COVID testing. So they'll see if he's had a couple negatives spaced 24 hours apart. So hopefully he'll be safe and everyone around him will be safe.
And speaking of being safe, people are suspecting that it was the Rose Garden ceremony surrounding the Supreme Court nomination of Amy Coney Barrett, where this started to spread because we've seen, several people who have been diagnosed who were in attendance. Can you talk about how COVID spreads? And even though they were outside, obviously people there were still at risk.
You raise a great point, very important. And yes, there unfortunately been a fair amount of cases directly to that event and then after that event. So what's happening is a lot of them weren't wearing facial coverings. Testing alone does not ensure safety. And so what happened is, in that very ceremony, they weren't even following the latest guidelines that all of us need to do. So it shows that this type of virus is very communicable just through the air. Even if you're outside, if you notice, they were all sitting close together. Almost all of them were not wearing facial coverings. And as a result, some of the biggest leaders in our country who were there have come down with COVID-19.
Yeah, really disconcerting to see that video there. Now, as far as the president's treatments, he got that antibody cocktail from the biotech company Regeneron. That's been getting a lot of attention because he's been talking about it so much. He claims that it cured him. Is it possible that that antibody cocktail actually cured the president?
So these are specific antibodies called monoclonal that attack or prevent this virus or decrease its ability to infect a person. Now, supposedly the timing, within 24 hours, the president stated he was feeling better. And, we always want to believe the patient. But, scientifically, this is a medication that has only been, the release is on 275 patients. We have the results of over 2,000 that have been tested. So it's still very early. And also, it's important to remember that the president also was receiving other medications, including remdesivir and also dexamethasone. And, steroids sometimes could give a person a lot of energy initially. So, it's very early within 24 hours to say that Regeneron, the CoV-2, that medication, cured, because we can't really say that. It's way too early. We need more information. And it's important for everyone to know the medication that was spoken about does not prevent someone from getting the infection. It does not. What it does is if someone has the infection, it could help supposedly decrease the symptoms and decrease the severity. And the data that's been released was only released in patients who are studied as an outpatient. In other words, people with less severe cases. So we need much more information, and that's really important. Some people have been calling and say, oh, can I get that? Will it stop the disease? Or I won't even get the infection. No, you can still get the infection. So we're still waiting to see how well this works, and they've applied for what's called emergency use.
Right.
So we'll see what happens.
Right. They're hoping to make it available to many more people, so we'll have to keep on top of that. Dr. Rob Danoff, thanks so much for your time. I appreciate it.
Thank you. Be safe.
All right. You as well. Have a great week.